Bob, he and I used to share two small adjacent offices in the admin area of the emergency department. So I used to go and hide, essentially take cover in his office. And that's where I really got to know better this incredible human being that is so affectionately referred to by all the nurses and by many staff members as Dr. Bob.
He just introduced himself as Bob, and so I always just called him Bob.
Dr. Bob was one of the original docs when I started in the emergency department, and I also had the pleasure of working with his wife, Dr. Pamela Adams. It was always great working with Dr. Bob.
Bob has always been very kind and even-keeled, and even when the ER is in a complete, disaster mode, he does not flip out, he doesn't yell, he doesn't get flustered, and takes great care of his patients and is always good to the staff.
Fun, lively, energetic, always easy to talk to, could interrupt at any time if you had a question, and really took the time to sit down with the staff and his patients and explain what was going on, but kept the flow going.
Whether it be a quality issue or something with the medical staff, he's always got the patient first. And I've appreciated being a colleague, and actually appreciated all of his mentorship all these years.
A lot of people don't realize that Bob is actually a very tall figure in the world of emergency medicine. They just know him from Suburban, but he had a long, distinguished career before being here at Suburban. And so he's been a great person for me to be sort of mentoring under all these years. And as professional, as dedicated, and as impressive as he was, I remember that very first day that I looked down and he had some really pretty old loafers that he was wearing. And I think he's still wearing the same shoes. So Bob, part of my parting gift is going to get you some new shoes.
My son needed to wear a suit and tie to a wedding, and he does not know how to tie a Windsor knot, and neither do I. So one day I was talking to Dr. Bob and I said, "Do you think you could teach me how to tie a Windsor knot?" And he said, "Oh, sure." At which point he took the tie right off his own neck and proceeded to teach me while it was on him, while it was on me, behind me, in front of me, whatever it took for me. I'm not so sure that I was the best student, but we managed, and that boy wore a tie to the wedding and he looked like $1 million.
He has this crazy devotion to Suburban, where I would come and drive in for my 6:30 a.m. shift, and there's Bob's car. And then I would leave any day, given day, at like 7 p.m. and there's Bob's car. Well, I was sitting in a meeting with him, and I looked over and I was like, "Bob, you don't look so good." And he's just sort of mumbled back to me, and I was like, "You're sweaty and pale." And he grumbled back, he's like, "I'm just getting through a kidney stone." And I'm thinking to myself, that's crazy. Like, who would go to a meeting while trying to push through a kidney stone?
He's one of those rare personalities that any physician will probably run into once in a lifetime career. Now, he's extremely knowledgeable about clinical matters, and this is almost in every specialty. He has been able to transition, almost to mutate so smoothly from being a practicing ED doc into such an incredible VPMA. To me, it is truly mind-boggling and a testament to his superior emotional intelligence.
Just being here always, I can't imagine life around Suburban without him, but I do wish him all the best in his retirement years, and he deserves it.
He's a wonderful man. He's a nurse advocate, patient advocate, and we're losing a great guy here.
I'm just going to miss the guy. He's been a fixture and just an important piece of the hospital, of emergency medicine, and of the leadership here.
I will incredibly miss his guidance and his words of wisdom, which have so often kept me out of trouble and even gotten me out of trouble a couple of times. And so I just want to wish him, all the best in his retirement.
Oh, that he just enjoys his grandchild, that he has a great time in California, and just is able to, he and Pam just enjoy their new life.
I'm happy for him finally going on to his retirement, and hopefully he enjoys that. California, here he comes, Dr. Bob.